Good morning, everyone, and welcome back from the break, and welcome to this panel discussion on mis and disinformation, truth in a turbulent world, public health strategies to cut through the mis and disinformation noise. My name is Dr. Alex Summers, Medical Officer of Health at the Middlesex London Health Unit, and it is my absolute pleasure to moderate this discussion. Just a quick reminder about how the session is going to unfold this morning. We're going to begin with a panel discussion, followed by a question and answer period. To ensure an engaging and optimal experience for all, the Zoom chat and participant audio video features have been disabled. Please feel free to submit any content-related questions in the Q&A pod at the bottom of your window. For technical issues, you can email topic, TOPHC, at oahpp.ca. We're very fortunate to have an amazing group of panelists with us this morning, each bringing their own experience and insight into the issue of mis and disinformation. Over the next 30 minutes, we'll dive into a discussion that will help us move beyond definitions and explore practical, real-world strategies for responding to false and misleading information, understanding its impacts on communities, and strengthening public trust. Let's meet our panelists. I'm going to introduce our first panelist, Dr. Jennifer McWhirter. Dr. McWhirter is an associate professor in the Department of Population Medicine at the University of Guelph and the director of the Health by Design Lab. Her lab's research focuses on the design and assessment of information and places and the systems that shape them to promote health and prevent disease at the population level. Jennifer, welcome. Next, we have Dr. Blair Bigham. Dr. Bigham is an award-winning journalist, scientist, and physician who trained in emergency and critical care medicine at McMaster and Stanford universities. He was a global journalism fellow at the Munk School of Global Affairs and associate scientist at St. Michael's Hospital. His work has appeared in newspapers, magazines, newscasts, podcasts, and medical journals. He is now an assistant professor at the University of Toronto's Dalla Lana School of Public Health, where he studies public trust and science communications. Welcome, Blair. And finally, we have Professor Neil Seeman. Professor Seeman is an author, publisher, Toronto Star columnist, and University of Toronto professor and senior fellow focused on the intersection of mis and disinformation, mental health, and technology. He is the co-founder and publisher of Sutherland Health Experts and a fellow of the Fields Institute, the Hive Lab, and the Investigative Journalism Bureau, where his research examines how online narratives shape population health, trust, and policy. He previously founded the market research platform RIWI and the Health Strategy Innovation Cell, organizations focused on tracking and understanding misinformation online globally. Welcome, Neil. We really are very fortunate to have these folks with us this morning to learn from them as the field. So thanks for spending your mornings with us. Now, let's get into it. We're going to kick things off with a question for all of our panelists. With a rapidly shifting media landscape and rising public skepticism of science in North America, misinformation spreads rapidly, often before public health teams have the opportunity to respond. Based on your experience, what practical approaches can help public health units identify emerging narratives early and respond in a way that both accounts for potential community impacts, all while strengthening public trust? To kick things off, I'm going to go to Blair to provide some thoughts on this. Blair.
Thanks, Alex. And hi, everyone. Good morning. I don't think there's an easy answer to this question. And if you're feeling anxious that you're doing something wrong, I don't think you are. I think we're all trying to figure out in this rapidly changing ecosystem how to communicate with people in a way that resonates and how to, I guess I'll use the term, get ahead of misinformation. But in a way, the paradigm is flawed. If our goal is to get ahead of misinformation, I think we're still stuck in this information deficit model where if only we could get information to people faster, they might make different choices. I think if we flip that around and instead of giving information, start receiving information, we might be off to a better start in terms of fixing this trust deficit that we're all experiencing and fixing this sort of rapid AI-empowered machine of artificial intelligence and misinformation that really I don't know that we can get ahead of. Instead, what we can do right now is engage all of the communities that we serve, including micro communities, and try to build trust in those smaller groups of people so that when there is a high priority message, we already live in that space and we're already able to communicate with them. Now, there are ways that AI can help with this. AI can be used to surveil for misinformation. It can be used to create content that might battle misinformation. But right now, we can all start working locally to build and keep trust and build engagement with the local communities that we serve. Instead of taking sort of a one size fits all approach where standing in front of a podium or releasing a press release is expected to get to even 50% of the population, having a communication strategy that breaks it down into micro populations that can be targeted depending on the health emergency or the health messages that need to be shared at the time is probably, it sounds like a lot of work up front, but the yield later on is going to be exceptional.
Thanks, Blair, for those reflections. And as we think about those micro communities, I think many of us are reflecting on our own communities and recognizing that it's not just one jurisdiction anymore, it's many within. I want to go to Neil next to get your thoughts on this. Neil.
Thanks, Alex, and welcome everybody. And thank you, Blair. You're always inspiring to me as well. And thanks to the panelists. Alex, when I was last giving a talk to Public Health Ontario, it was 2008. Elon Musk had not joined Twitter as yet. Goodness, the iPhone was nascent, and to the extent we were talking about social media with healthcare audiences, it was all about how to use it to push out information, to educate the public, and in particular, quieter voices that were not otherwise accessible. Now, moving forward today, goodness sake, everything's changed. And to the extent we can use tools and AI in particular, what I recommend and what I've been investigating with, as of others, is using AI to extract messages and misinformation that people are using in narrative online, on Twitter, on Reddit, and thereafter to test narratives in real time. So you can come up with narratives, test them on forums, and then figure out whether or not they work. And you can build them into your PDSA, Plan, Do, Study, Act model in a very inexpensive manner. That's not going to solve the problem, but it's one way in which these platforms can help us now versus in the past.
That pace of change is just extraordinary as we think of, um, yeah, the world that was 2008 seems a lifetime ago in so many ways. Jennifer, we'd love to hear your thoughts on this.
Thank you. Thanks for such an excellent question, and thanks for the opportunity to be on the panel today to discuss such an important topic. Effective communication is essential to effective public health practice, so I'm really glad we're focused on this right now. I think I'll go narrow and then broad in my response and maybe pick up on a couple of key things that Blair has already highlighted. So certainly monitoring the information environment and analyzing the narratives that are there is really important. Being visible and accessible to the communities that we serve is essential. And as Blair mentioned, not just communication outputs, but making sure we're really engaged in two-way communication. So hearing from our audiences, hearing from our communities is really important. There are times, especially on social media, where sometimes it feels like there's not capacity in public health to engage in responding to comments, but we absolutely need to be doing that if we're going to build trust and if we're going to tackle mis and disinformation effectively. There's a famous quote that goes something to the effect of the biggest challenge with communication is the illusion it's taken place. So we need to be really careful and evaluate that we actually are achieving what we're hoping to. And then I think more foundationally, you mentioned trust. So I think more foundationally, we need to get really good at marketing ourselves as public health and what we do, all the good, great preventative upstream things we do, so that when people do turn to us with a listening ear, they're more likely to be receptive.
Alex, can I add to what Jen and Neil just said? Which is, I think it leads to this idea of platform proofing ourselves. So to Neil's point, like back when Twitter was Twitter, like everybody cared about how many followers they had, and that's where you went for information. Like there was like no one would have second guessed that Twitter wasn't going to continue to be the powerhouse that it was. Um, and then we found that as platforms evolved and there became more and more of them, they would come and go. They would target certain demographics. They would target certain audiences, and they all had their own style. And so I think for me, like as a scientist, like I don't know how to create an Instagram versus Snapchat, which no longer exists, versus X versus Facebook content for those audiences. They all have their own vibe. The production costs and time is like something that I can't afford, nor do I have time for. This idea that we should all be experts in social media, it moves so quickly. I don't know that we should be. Should we be on social media? Absolutely. We should meet our communities where they are. But if we focus on what Jen said and build trust in those communities, then as the platforms change, the trust shouldn't. We should still be engaged with those communities. And we can almost, not have that pressure of being on the latest platform or having the flashiest video or knowing the style of video for that particular app.
As we're working through this conversation, I'm kind of astounded by the fact that we're talking both about these emerging things of AI, but at the core as well is good old school relationship building, listening, trust, right? It's some of that stuff is fairly familiar to us or ought to be. Thank you, Blair, Jennifer, and Neil. Those are wonderful reflections as we start our panel this morning. I've got some follow-up questions to start with Neil. Building on our conversation, what strategies can public health institutions, like local public health units in Ontario and others, use to assess and build trust and engage in ways that reinforce civil discourse and confidence in public health systems? How do we get into that conversation, build trust, build credibility in a way that allows for that safety in language and conversation?
Yeah, thank you. Thank you, Alex. I'm of the view, and many people are, that you can't separate this conversation around misinformation with the challenge we're having in civil discourse and people not talking with one another and polarization. So to step back again, in 2008, when this was just on the radar for the first time, to the extent people were trying to do this, they were talking in healthcare and public health. We were talking about post-partisanship, processes in which we could all come together, lay bare our assumptions, and then work towards a conclusion. And there were some really interesting leaders in this regard. However, now, today, given just how polarized we are as a society on public health issues and a wide variety of other topics, I'm of the view that we need to focus on pre-partisanship. And what I mean by that is we need to help educate people, ideally at the K to 12 level, but younger people just generally. I think we need to do a better job of educating people about what these institutions are there for, whether it's the media to hold government to account, whether it's the chief medical officer of health. What are their roles? And I think that can help institutionally, because this is all with a view to increasing both institutional trust and interpersonal trust. And so the other thing I would suggest is something that's really been built into private sector organizations over the last few years, which is to measure trust in real time as much as possible. Nowadays, there are emerging indicators using survey data that we can use to measure trust, both at the local level and broader. And we also know from increasing research that trust is hyperlocal. And the more we can build that, the better we can tie that to results. If we can measure that over time, and we can also intervene. Thank you.
Thanks, Neil, for those reflections. And that polarization is something I think that certainly for those of us who are practicing in the field, the pandemic very much highlighted the polarization of how we were trying to engage around science and fact, and it made it very challenging. And so I think that challenge of addressing the polarization of science through the work that we do is really integral for us and understanding how we build that trust in a way that does so. I want to go to Blair next. Blair, drawing on your experience in both clinical practice and journalism, what communication missteps most commonly erode public trust at baseline or during emergencies or other times as well?
I think there's two elements to highlight at first. And the first goes back to that information deficit model and sort of a generic or a one size fits all approach message to a population that is rooted in this idea that people need to know something. I would I would actually work backwards and ask myself, what behavior do I want to influence? And in whom do I want to influence it? And if you start with those two questions, your communication strategy instantly changes. It becomes much less about the information that you think someone needs to make that choice, and much more about exploring and constructing an understanding of how people are actually making choices. Because how many of my patients and their families make choices? Not how I make choices at all. And so when I go in and say, oh, I would want to know my lactate and my creatinine, that might not be what families want to hear. And so walking in to a clinical situation, I'm there to find out what information they find helpful in order to make a decision that I think will support their health. And so that is a different approach than assuming that we know what people need. And I think we saw this very much in the pandemic with how social media influencers were able to win audiences. They gave the audiences what they need. So, what did audiences need during the pandemic that public health wasn't giving them? Number one, certainty. Public health wasn't giving them certainty because there was no certainty. But influencers gave certainty. Now, is that right? I don't think so. A lot of what influencers said ended up being wrong. But I think what we can do is we can look at what was popular and what was acted upon during the pandemic, and we can almost kind of seek a bit of inspiration from that style, that direct connection, that I'm here for you. I'm looking at you into the camera on TikTok, making an appeal to you because I've been where you've been and I'm advocating for you. That kind of works on social media, and I think a lot of us find it cringy, but it does work. And so rather than being repulsed by it, I think we should at least be open to learning some of the tricks of those communication styles that do resonate with people, to see if we can build trust by being where they are, by resonating with them in their moment of distress and their moment of need, and understanding what is it that you would need to make a decision. And that may be one of the bright sides of social media is that it has exposed or perhaps created a way of resonating that maybe we're not used to and maybe we think is kind of slimy and gimmicky. But there may be a couple of pearls in there that we can turn towards.
That cringe factor, I think, can be a big barrier for us in practice sometimes. This desire to not be the uh, institution that is trying to do something organic and ends up kind of looking fake. Have you, I put not to put you on the spot, Blair, but like, are there some
Yeah.
examples of people that have done this well? Because I think it's one of those big fears where I show up in
Yeah,
the goofy looking shoes because I'm trying to be cool or something like that.
right. So, doing it well is, I think, we can objectively try to define what does well, but subjectively, what I think does well or doesn't do well I might actually be perceiving that wrong. And part of the problem academically is that deriving actual impact is difficult. We have shares and likes and retweets. Like none of these are really good measures of impact. But I'll give you just an example from my own back when Twitter was Twitter. One day, my Twitter followers doubled. I doubled my followers. And what I had tweeted mid-pandemic was that all I said was, I'm too tired to eat and too hungry to sleep. And when I woke up after, eventually, when I woke up after that 24-hour shift in the middle of the pandemic, I had doubled my Twitter followers. I didn't say, man, we're so busy, these people on ventilators, blah, 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 blah. All I said was this emotional, like in an exhausted state. I was vulnerable, I was personal, and I doubled my Twitter followers. My second best performing tweet, and I'm an investigative journalist, I spend months or years on a story and then I put it on Twitter and I get like 300 engagements. Um, my second most engaging thing was when I tweeted a picture of myself at the park having brunch with my husband, and we had brought a stuffed cat who we affectionately call Doug. And Doug the cat is a prominent feature in our adventures when we go on road trips. And we just tweeted a picture of us eating brunch in Riverdale Park with Doug the cat. And it just blew up. Everybody loved seeing Doug the cat out for brunch. So those are just examples of what drives engagement on social media and what people resonate towards. And people say, okay, but that was totally useless. There was no benefit to you sharing a picture of a stuffed cat. Um, but what I did was I continued to build a bond with my audience. I continued to show them who I was. And I would like to think that the next time I publish something investigative or the next time I publish something that is designed to influence opinion or behavior, they might look at it a little more closely because they know me a little bit better. And I think this is so uncomfortable for people who work in public service, for physicians who are licensed. I think we worry that when we're vulnerable, we open ourselves up to criticism, we open ourselves up to attack, we open ourselves up to complaints or political retribution, and all of that is true. But I think we need to calculate that risk into the way we operate because I think the payoff is greater than the risk when we are vulnerable and we develop that relationship with audiences. It's very, very tricky. But when I think about those two examples for my own social media presence, they were relatively unplanned. I didn't think that they would have the impact that they did, but I know that what they did was build trust with that audience of followers. And I think there's lessons to be learned from that.
Yeah. The word that really resonates as you were sharing there, Blair, is authenticity, right? Just this idea of authentic expression of who we are, not only as institutions, but as people, seems to make a difference. One of the things that we always reflect on kind of organizationally or even across the field is it's really hard to have those big conversations unless you've had some experience having the small ones, right? And in a lot of ways, the too tired to eat and too hungry to sleep, or here's Doug. Those are the small conversations that mean that when you do the big investigative thing, those are the big conversations people are ready to listen to you about, and that's that authentic building.
Family doctors understand this
Better.
intimately, right? They build it over years of these tiny little conversations, and then one day it
Yeah.
all pays off.
Yeah.
And I think I try to bring that philosophy into my practice, and I think it works on a larger scale of science communication as well.
Yeah. 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 Parenting 101, family medicine 101, the list goes on. Thanks, Blair. Jennifer, I have some questions for you. Given your experience in visual health communication, what key design principles should public health agencies prioritize when developing visuals or infographics to minimize misinformation and maintain credibility when we're countering that type of misleading information?
Yeah, thanks, Alex. And Blair's comments are a great segue. The picture of Doug the cat and having brunch. Pictures are incredibly information dense, and that was a great example of how, even though that particular image wasn't designed to communicate a specific health message, it had this broader impact of building an audience, building trust, being authentic, and kind of contributing to creating a messenger who will be turned to and attended to carefully in the future. I would say that visuals are at least as important as the text that we are putting out into the world for our audiences. And because of that, we really need to attend to them carefully. Perhaps partly because we process images so quickly and so well, we sometimes have a tendency to not attend to them as carefully as the text. And sometimes they are a bit of an add-on or an afterthought when we're putting messages out. And so one of the key things I want to emphasize is that we need to attend to them just as carefully as the text. There's different ways that we can do that. Many of the same public health communication theories, practices, tools, guidelines can be applied to images as well as to text. So I would encourage folks to lean on their knowledge of theory to select images. Thinking carefully about the purpose of the image. Is it to capture attention? Is it to encourage reflection? Blair was speaking to behavior. Is it to motivate a certain behavior? So making sure the selection of the image or images align with that purpose is really important. Pre-testing, co-development, evaluation of the images with panels or with their audience is important for visuals as well as text, as everyone already knows. And I think there's a little bit more to say there about maybe systems level approaches and investments, but I'll maybe save those comments for a little bit later in the conversation.
Thanks for those reflections on that visual aspect, how we communicate and how we build that trust. I want to move on to another question for everyone here. Once misinformation has become established within a community, some of those micro audiences or micro communities that we talked about earlier, or broadly, rebuilding that trust can be really, really challenging. And I think for us in public health, it sometimes feels like we're living that every day post-pandemic. What partnerships or engagement approaches, whether it's involving community leaders, journalists, or lived experience experts, have you found to be the most effective in restoring trust, strengthening dialogue, kind of getting us back on the radar? Neil, I was wondering if we could start with you.
Well, thanks, Alex. When I think about this fascinating question, I'm reminded back to 2014 when we were tracking public perception toward Ebola. And in Lagos, it was very interesting because there was a lot of optimism. There wasn't the panic and fear that was seen elsewhere because there were bonds that had pre-existed and continued with local mosques and churches, which reached out to local publics. And now, increasingly, as we study this around the world, some things that are interestingly replicated is that local is high trust, and we're finding nodes of trust. So big generalization, but we're finding in low, middle, and high income countries, young women in particular are high nodes of trust. So young women sort of adopt public health messages, young men follow. So again, these need to be evaluated and measured as we go out, and then we find the node and we help determine how we can help them amplify their voice.
Thanks for those reflections, Neil. Jennifer, I want to hear from you on this too.
Certainly, in any relational context, trust is easy to lose and difficult to gain back. So certainly focusing on it is really important. I think for my response, I'll pick up on my comment about systems level approaches from earlier. To tackle this challenge of mis and disinformation, while we really do need to take this foundational systems level approach, in my opinion, there's different ways we can do that, but we definitely need to invest in public health communication at the systems level. A few ways that might happen, leadership earmarking funds to build capacity to do effective public health communication, more public health professionals working in specific public health communication roles, and establishing a plan for workforce upskilling for the existing workforce, but also kind of creating this pipeline of really well-trained public health professionals to do really effective public health communication practice.
So we've heard about local, finding those nodes, investing in the people, and the skills and the assets to do it. Blair, I'd love to hear your reflections on this as well.
I want to just say ditto to everything Jennifer said, because that's my whole life, is trying to teach skills to better communicate. But there's a shortcut here, and that's to find the people who already hold influence or trust over these micro communities. And so that may mean partnering with a religious leader. It may mean partnering with a celebrity. It may mean partnering with a local politician, partnering with somebody who is already there, who already understands the group, who can help us communicate our message. During the pandemic, Anthony Fauci could stand behind a podium and say anything, and about half of America would believe him, and the other half just wouldn't because he was standing behind a podium. And so, how do we get to that other half? It may be through disseminating our message through intermediaries, through people who already have the trust and understanding of local populations. And that may be a shortcut while we ramp up the way public health professionals are taught in their graduate training, while we try to develop technology supported ways of creating micro messages or audience specific messages at scale that can get to these nodes. While we're working on all of these opportunities that you would think would pay dividends in the future, in the meantime, it may just be picking up the phone and seeing if Katy Perry is willing to drop a comment for us. It may be that we pay influencers on TikTok, the way Colgate and Big Sugar pay influencers on TikTok to say certain things. We may have to go to slimy marketing strategies. That's our perception, right? They're not. Marketing strategies are used all around the world to make companies trillions of dollars a year by convincing people to do one of the hardest things, and that's open up their wallet. And so I think that there's lots of lessons to be learned from traditional marketing that might help us, plug the hole and build the ship while we're sailing it.
Yeah, absolutely. I can certainly tell you, Blair, that if the Middlesex London Health Unit managed to get Katy Perry to amplify our message, that would certainly cause some fireworks locally. Oh,
Oh,
boo.
oh dear.
Uh-oh,
We
that's a
just
good.
lost half our audience.
I know, I know. Speaking of out of date, and that's a good as transition as any. Thank you very much for the conversation. We're gonna look to the audience and get some questions and start to build on some of the conversations we've already had. Um, I want to start with this one that we kind of referenced a little bit was around how do we measure our impact? How do we measure if this is working? So one of the questions from the audience is, do you have any ideas or suggestions on how to effectively evaluate our communication interventions to ensure that we are achieving what we are setting out to do? How do we measure if we're competing with that mis and disinformation on social media? How do we measure trust for that matter? Um, I'll look to someone to jump in if you're so inclined, if anybody has some thoughts. Neil, you've come off mute, so I'll go to you.
Thanks. I mean, this is a really tough one. I think it's critical. So in the private sector, what's often done is, you put at the top of the pyramid. Patrick Lencioni's work on building trust and measuring it is really valuable. And so there's been a lot of interesting survey data. The OECD has come out with interesting indicators on trust. The other way to think about message evaluation is in my view to extract from message boards, and there's some really simple coding you can do to determine sort of what quiet communities that you don't know about, like why are they resistant to routine vaccinations? Why do they not trust public health authorities? And then when you learn what they're saying, you can kind of come up with very localized messages. Hey, we're seeing more hospitalizations in our local area, and we're among those who are not vaccinated. Maybe that's a message. You then test that message and evaluate using interesting AI tools to see how that community is responding. One tool.
Thanks, Neil. Jennifer.
I can add to that a little bit. So the first comment is not reinventing the wheel. So the Canadian Medical Association for the last couple of years has done some really great foundational survey work on Canadians' trust in medical information and medical professionals. And some of the questions in their survey work has touched on mis and disinformation as well. So I would encourage folks to rely on that those big sets of national data that are starting to come in, and I commend the CMA for doing that really important work. And the second I would say is when evaluating messages, and as well as when designing them, is to remember qualitative ways of evaluating are just as important as quantitative ones. So speaking to panels of folks who are representative of the audiences and communities you're serving or trying to message, to check about those messages and images as they're being developed and to help evaluate their impact. As one of our fellow panelists said earlier, though, measuring impact is really tricky with communication, but there are lots of sort of proxy questions we can ask to try and check in to see if the messages are resonating appropriately. And then, I think I say this with caution, given the focus on communication with our panel today. But effective communication is essential, but it's not the only thing, right? We continue to need our policies, our good environmental design to nudge people towards healthier behaviors as well.
One of the critical evolutions of our practice is recognizing the behavioral economics or social marketing is more than just the message per se. There's so many other variables that go along with that. One of the other themes of questions that's coming through is talking about the worry of the other side of the AI thing. So they can provide some tools, they can help us, all that type of thing. But on the other side, like, what do we do to address that reality that either algorithms or AI algorithms are reinforcing mis and disinformation? What do we do about that? How do we even get in that game? It feels like we're facing multi-billion dollar corporations who are manipulating the system. How do we deal with that, Blair?
This keeps me up at night. I don't know if, I mean, like AI gets better by the day. It's becoming extraordinarily hard to tell what is real from what is not real. And news outlets like mine are investing a huge amount of effort and time just to verify a photo that we don't like. 6 months ago, we never would have put time into verifying, and now we are scrutinizing everything. And so this is a rapidly evolving and scary area of the world. And like even there was that tragedy at LaGuardia recently, and the AI fakes coming out just around that are wild, right? Like AI is almost ready to take over making Hollywood movies. And so I don't have a good answer for you. It stresses me out. It tells us how important and fast moving these times are and how much investment public health needs to be able to play in the space. And there's never enough dollars to go around, but there's no way public health, as it's currently structured, has any chance of keeping up with AI deepfakes. Like it's impossible. So what can we do? Well, we can rely on what we're already positioned to do, and that's build trust and try to use a combination of engagement and authority to get through to the population that we can get through to. But the potential for AI to lead people astray in how they make decisions is terrifying. It's an urgent threat, and I don't think there's great answers. I guess the best answer I could come up with to provide a little bit of hope as I stop talking is that AI could fight AI. AI is used to detect AI, and so there may be ways in which technology can aid us in this. Certainly, the social media companies could take up this challenge in a more earnest way. And there's even been suggestions that public health and health professionals will have to put their information on a blockchain just to verify its authenticity for the 50% of the world that is still interested in expertise, so that they can say, well, wait, how do I know this is actually coming from Middlesex Public Health and not from something that looks like Middlesex Public Health? And so that may be actually sooner rather than later something that all professional communicators are moving towards.
Neil, I've seen you come off mute. Maybe I'll go to you.
Thank you, Alex. Very, very briefly, echo Blair's concerns, and it just magnifies all the reasons why we need to do things like pre-bunking, source checking, educating the community about these things. Is it a high emotionality claim, and to question it. The one thing that really gives me hope here, I don't know the answer. But I think that the source for the answers can be found among young people. There's no cohort more concerned about this very topic that Blair identified than young people. They're aware, and I suspect I'm really excited about sort of these hackathons that are popping up, all with a view among young people to address these issues. I mean, as we know, public health journalism is not about one audience, it's about different publics. And I think the more we can engage young people, and I'm thinking in the high school level, to address some of these questions, I think we'll come closer to the answer.
Thanks, Neil. Jennifer.
I echo what's been said so far. So certainly there's immense cause for concern. There's also reason for hope, and Neil spoke to that a little bit with relying on young folks to help solve problems and get ideas about where the big concerns are. Um, Sort of in the short term, not a solution, but a way to contribute. So continue to ask lots of questions about what the impact is, what the solutions are, how you can contribute to solutions. And one example of a small practical way is to get involved in opportunities for engagement. So, for example, the Canadian government has requested input on different AI related pieces of legislation. And so, when those opportunities come up, to offer your input or seek them out and try and communicate what you believe is important and concerning for public health.
Thank you for those reflections. It's very helpful to take us into a little bit of hope as we navigate what can feel like a bit of an overwhelming space. I think we have time for one type of brief question. And there's many questions in the chat. So thanks to everybody who has submitted all these wonderful questions. We won't be able to get to all of them by any means. But I guess the one theme that has also come through is we've talked a lot about social media, and then we've talked about relationships. Is there any world in which the social media space becomes so dysfunctional that we actually start to see a renaissance back to, I don't know, talking to people or doing it differently? And is that on the
We're
horizon
seeing
at
it
all?
now. We're
Yeah.
seeing it now.
Okay. Yeah. No, that was one of the questions that come through. So Blair, any other details on what we're seeing there?
The question, I mean, many people have abandoned certain social media platforms. Many people are keenly aware that it's really hard to know what's real, and they want to know what's real, and they want to make good choices. And so as people move away from wherever they're at now, we want to have big open arms and understand that these are confusing and rapidly changing times, and just really try to bury the hatchet with populations that we've argued with in the past. Really try to just have compassion for the Canadians who are just out there wanting to do what's right for their kid. And they're just being told a million different opposing things, and they don't know what to make of it. And I think compassion is it's a parking lot until we have a better way forward. But as people look to flee the uncertainty, let's embrace them.
A reflection I've heard recently this week was just that for most of human history, one of the biggest challenges was trying to find the information that you need. And now it is trying to sift through all the information that's there. And the institutions and the people likely worth following are those who are able to find the signal through the noise. So you have really helped us as a sector think today about how we find that signal through that noise, how we build that trust. And we're so grateful for your time here this morning and for everybody that's joined us. That brings us to the end of our panel discussion and our question and answer period. Like I mentioned, there were so many questions that we weren't able to get to. So obviously much more discussion needing to happen. I just want to thank all of the panelists for sharing their valuable perspectives and expertise. Your contributions have certainly deepened our understanding collectively of the impacts of misinformation, disinformation, and most notably, what we can do to continue to build trust, to continue to build that credibility so that we can do that critical work that public health needs to do. So thank you, Jennifer, Neil, and Blair, for spending your mornings with us. Before we continue to our next session this morning, we're going to take a 15-minute break. You may join our next session on quality improvement and performance measurement by clicking on the third link that was provided to you in your welcome email. For your convenience, we've copied the information into the chat box for you, and our next session will begin promptly at 11 a.m. Thank you, and enjoy the rest of your morning.